Oh, yes. Yeah, I received All right, good afternoon, everyone. That is the traditional town hall bell calling us to order. My name is Evelyn Kasuga. I'm chair of the board of directors for Arizona Town Hall, and on behalf of the board of directors and our president, Tara Jackson, and her team, and working behind the scenes, and many of our town hall volunteers throughout Arizona, we are delighted to welcome those of you present here and also those of you who are online. This is one of our inaugural background report launch events. We've never done this type of event before. So for those of you who are new to Arizona Town Hall, we're an Arizona-based nonprofit, and as Tara likes to say, a multi-partisan organization that educates, empowers, engages, and connects Arizonans to resolve important issues through consensus, and using a process based on respectful dialogue that values diverse perspectives, builds relationships, and fosters leadership development. And we've been doing that now for 60 years. So this is a big anniversary for us. So thank you so much for joining us today. So on the topic this year, mental health, substance use, homelessness touches individuals, families, communities, and certainly all of us in some way, shape, or form. The background report, which can be found on our website, those of you here we have a tweet, yes, you can scan the QR code and get copies of the document itself. And then also, more importantly today, the panel of experts you'll hear from provide a very unique resource, because throughout 2022, Arizona Town Hall participants, and hopefully many of you here in person and those of you online, you will have the opportunity to engage more deeply on this topic in your own communities, with a culminating statewide event sometime this fall on how to best address those intersecting issues. And we can't emphasize enough the importance of the background report to seed productive, solutions-oriented conversations. So a shout out to our longstanding partnership with ASU's Morrison Institute and the great work they did in marshaling authors for and editing the background report. So I am now delighted to introduce Christy Eustace, Senior Research Analyst for Morrison Institute and the editor for this report. So Christy, it's all yours.
Thank you so much. Okay. Thank you all for being here. Had the timing been different, I would have loved to be in the room with you all, but I'm grateful for you allowing me the time and space now. Okay. So my name is Christy Eustace. I am a Senior Research Analyst at Morrison Institute and one of the 2022 Town Hall Report editors. For those of you who are not familiar, Morrison Institute is a nonpartisan public policy center located in Arizona State University's Watts College for Public Service and Community Solutions. As an institute, we analyze important policy issues to advance public understanding in Arizona and beyond. We develop tools and resources that help communities make informed decisions, and we provide forums to engage in public policy research. So today, I'm really here just to set the stage for our fantastic panelists by providing a brief overview of the report, including why this topic was chosen, kind of our intent and approach to compiling the report, and then the report structure. So mental health, substance use, and homelessness was selected by the Town Hall Research Committee as the report topic because of the challenges and broad sweeping impacts associated with the intersection of these issues. So according to the 2020 point in time count, there were nearly 11,000 people experiencing homelessness in Arizona. Almost 2,000 people had chronic substance use, and over 1,500 were designated as having a serious mental illness. It's also important to note that these numbers are undercounts, given that the point in time count is conducted on one single day a year by volunteers. Also, this number does not include people who are marginally housed, so such as folks who are living with family or maybe living in substandard conditions. Adding these individuals to this estimate propels this number to nearly 44,000 people. That is well over twice the number of people it takes to fill the Phoenix Suns arena. More of the effects of these issues ripple across our communities and neighborhoods and impact more than the individual who is experiencing them. So there are impacts on health and social service systems, emergency systems, as well as the criminal justice system. And then there are impacts on our local economies and public spaces. Then, of course, there are the mental and emotional tolls for the individual and their support network, as well as the financial consequences for families, communities, cities, and the state. In sum, this topic was chosen for its relevance because these issues and their intersection are likely to touch all Arizonans in one way or another. So approaching the report, there was a collective effort to produce a document that is focused, fact-based, descriptive, and representative. And I'll tell you a little bit about what we mean by that. So focused meaning that to the extent possible, the content is focused on that unique intersection of mental illness, substance use, and homelessness. Fact-based meaning that content is supported by data and literature or grounded in the author's lived experience. So we encourage authors to include experiential knowledge, not only because it's incredibly valuable, but oftentimes it's also the only information that's available. Descriptive, the content explains the issue and does not advocate for one approach or position. And then representative. So this report includes statewide data and perspectives. We have authors from various service delivery organizations, government agencies, and academic institutions across the state, including rural Arizona. Okay, so this last slide just provides a snapshot of the report content and structure. The complexity of this topic did result in quite a lengthy report. Because of this, we crafted an introduction that really is intended to give the readers a preview of the report, but also laying some base level information about the issues. There's also cross references throughout the report so that hopefully readers can easily navigate to information that they're interested in. But for an overview, the report begins with a comprehensive overview of the issues and their intersection. Authors then provide an overview of integrated treatment and care in Arizona, structural factors that produce and perpetuate these issues, and options for recovery and stabilization. The report concludes with 10 spotlight chapters focusing on specific subpopulations who are disproportionately and or uniquely impacted by the intersection of mental illness, substance use, and homelessness. So although these issues can impact anyone, we also recognize that not all people are affected equally and in the same way. So thank you for joining us today, and thank you for your interest in this really important topic and very timely topic. We hope you'll explore the report and participate in both the statewide and community town hall forums that are going to be this fall. And lastly, there it is. Lastly, I just want to extend a sincere thank you to the report authors for contributing their expertise, time, and energy towards this critical topic and resource. And at this point, I will turn it back over to you all to get this panel discussion going. Thank you.
Thank you so much, and thanks to Morrison Institute for participating yet again. So we're excuse me, grateful for that support and partnership as we collectively create those solutions challenging and facing our communities and the state. So I'd like to thank our many valuable partners who help create the solutions to the most challenging issues. And those specific to this event are Northern Arizona Council of Governments, who is our venue sponsor, and then the Giesel firm, fiscal sponsor for the background report and launch events. And we recently learned that thanks to a generous investment from the Diane and Bruce Halle Foundation, we will be able to support more community and future leader town halls on this topic throughout the state. So after you hear from our expert panel, be sure to contact us at the Arizona Town Hall if you'd like to bring a town hall conversation to your community. And so we're excited to have that opportunity this year. I'd like to move ahead with introducing our esteemed panel members whose bios you can also find on our website. But today we have Janet Dean, Community Affairs Manager of Northeast Division for APS. Janet. Shawn now, who is a Chief Executive Officer for Blue Cross Blue Shield of Arizona Health Choice. We have John Rivers, Board Secretary, Northern Arizona Healthcare Board of Directors. Thank you. And Adam Shimoni, who is a council member for City of Flagstaff. And serving as our panel moderator today, please welcome Tara Jackson, who's president of Arizona Town Hall. Tara, take it away.
Thank you, Evelyn. Well, it's great to be here with all of you. And I know that almost no one else has an actual hard printed copy of the report. We fresh hot off the presses. We have a few of them. Nonetheless, we really encourage you to download it if possible, save a few trees. So those of you here in the room, you've got this card with the QR code. And our website is also an amazing resource, whether it's this report or some of the other past reports that are on there. So I encourage you to visit that as well, to use these resources. And thank you, Evelyn, for the introduction. And we are really just going to jump in because, as Evelyn mentioned, these report launches are kind of a new program for us. It is kind of the start of this topic and of discussions around the state that we hope to have with all of you in your community. And I'm really happy that we have both an expert and diverse panel here today. If you're new to the Arizona Town Hall, one of the things that we really value in coming up with solutions, working with communities for solutions, is bringing the diverse people across the table. So recognizing that it's not just the experts who need to look at the issue, it's also those who are dealing with the issues in other capacities. So our panel today in many ways reflects that. We have some who are experts on the issue, and then we have some who are either business or elected leaders who also have knowledge in their own arenas. So they're like, maybe. I will say that Janet Dean, when I contacted her, she's like, are you sure you want me on this panel? I'm not an expert in the issue. And I said, but you are a business leader and expert in your community. And it is about all of us coming together around these topics. So let me throw out the first question, and whoever wants to start it out, feel free to answer. And that is, of course, our topic is mental health, substance use, and homelessness. And as Christy mentioned in the report, there was a deliberate focus on the topic of how these intersect and work with each other. Why is it important to consider all these three areas together, and how do they relate to each other?
Happy to chime in if you want me to.
We're all looking at you.
I was the closest one to you, so I figured no problem.
Shawn, please.
Yep. So first of all, thanks for the opportunity to come today and speak and participate with this discussion. Obviously, from our standpoint, Blue Cross is the largest health insurer in Arizona. Health Choice is the Medicaid arm of Blue Cross. So we're just a small part of the much bigger Blue Cross family. But because we're directly involved in serving Medicaid populations, the three areas that we're talking about today are everyday portions of our lives and how we work with our members who are experiencing homelessness or at least challenges with housing in many instances, challenges with substance use, and challenges with mental health. And they are directly connected. We've for years adopted what we call the housing first model, which is a national best practice model, which does focus very heavily on ensuring that to the extent we possibly can, that individuals receive or have opportunities for temporary shelter services all the way up to permanent long-term housing. But even when you're capable or able to situate individuals with solid housing arrangements, they won't be able to stay long if they can't manage substance use challenges or mental health challenges. And it's certainly become even more challenging. So this is a very timely conversation because in this kind of middle of to post-COVID world, whatever we're in, those challenges have become more acute. We're seeing more and more throughout the Arizona population. Those numbers that the Morrison Institute mentioned are very definitely underreported. That's the tip of the iceberg in reality. So I think we tend to think of these topics as if they're three disassociated things. The reality is they're part of a milieu that represent an increasing challenge to the populations throughout Arizona, before. So having this as a focus right now is incredibly appropriate.
Thanks for that. And I think John might be next. He started to open us
Yeah,
out.
well,
So I'm gonna call up. Yeah.
You'll see that a lot. And, I think Shawn said it very well. I think the background report, which by the way is an excellent report. If you have not had a chance to read it, everyone with the remotest interest in this topic should look at this report. It is laced with references about what I think the report characterizes as the bidirectional nature of these three entities, saying that, if you're going to address issues of substance abuse, you're going to run right into mental health issues and vice versa. And if you start addressing issues of substance abuse and mental health, it's going to take you right into the homeless arena. These three issues are so interconnected that it's almost impossible to deal with one without dealing with the other two. And I think that becomes pretty self-evident as you read through the report. It's in some way a part of almost every chapter that's in it.
We've had 2 other background report launches like today's already. And one of the phrases I heard that I thought was very interesting to me as a non-expert in this area is that housing is healthcare. And I'm seeing the head nods that if you provide housing, healthcare costs go down substantially for the population, so that stable housing is of economic benefits to communities, and there's a connection. And I'm going to go on to our other panelists in just a second. We forgot to mention one thing. If any of you have questions who are here in the room, there's some question cards. You can write it on the question card, pass it down to Evelyn. If you are online on the webinar, you can put that in chat, and Alex from the town hall, who is monitoring that, perhaps you could text either Evelyn, text Evelyn any questions that you get, and we'll see if we can incorporate those. So when I mentioned housing is healthcare, all you two are sort of non-expert panel members, non-expert on the topics at hand, but experts in your community. You are nodding your head vigorously. I'd love to get your thoughts on that.
So thanks for the question, and that's definitely a sentiment, housing as healthcare, that I hear in my role in the community. I hear it and Tara said, I'm not an expert, and I'm not. I work in community relations. I am an involved community member. I have a little experience in this, having a husband who was in law enforcement, but from the perspective I'm going to speak to is as a funder. I help fund community organizations. And what we're looking for is we're looking for outcomes from those organizations. And we're not looking for, this is how many people we serve, but we want the outcome. And what we hear from the organizations we work with is just that sentiment, that it's all of these things intersect. And if we're not addressing all of them, then they struggle to get the outcomes that we're looking for to help fund and help create a more diverse and vibrant community.
Adam.
Hi, everybody. I'm Adam. Nice to be here with you all. Thanks for inviting me. As a non-expert myself, I've definitely learned a lot over the last 3 years of my service in council, and this has been a very strong topic of interest for me myself. And I've been engaging with our service provider leadership, our police chief, our fire chief, our many community partners, and in Flagstaff, we have a really strong knit community who are working together on these topics. And as the other panelists mentioned, none of these are standalones. They're all intertwined. And as a council member, trying to really help what we're calling a vicious cycle that people continuously going through, we have to think of it holistically. So I've been trying to better understand holistically what needs to be done to better support our population. And so, as you're saying, as everyone's talking about, housing is healthcare, and what I've seen over COVID, especially with the hotels that we put up for our unsheltered population, so that they can isolate, in partnership with Flagstaff Shelter Services, FSS, the largest shelter in the region, is that the numbers of police engagement and fire engagement dropped dramatically with this population. So right then and there, Ross from the shelter and I were like, there it is, there's your proof. Housing is healthcare. We need to get these people into housing. It will save us money and it will be a win-win in the end and it will help folks. So, partners like FSS and Housing Solutions in Northern Arizona have acquired motels recently that they're converting now so that they can offer housing opportunities. And there's just so much great work in the community right now that I can speak to, but yes, we need to get folks into housing and then we need to blitz them with wraparound services and all sorts of opportunities for their own success. I guess I'll leave it at that there for now. Thank you.
So a couple of things I should mention, if you're new to the Arizona Town Hall and the practices we use for engagement, we have kind of this rule in our programs that we use first names and all the titles are left at the door because all the voices are equal. So I thought I should let you know why I'm calling everyone by first name versus whatever titles you may have, right? And then to that point, Adam, you mentioned this idea of the impact that sort of wraparound services have, and you gave a very specific example. I think it's helpful to have specific examples. So the question I would ask, whether you're an elected leader, a business leader, or more the experts in the field, we see I'm right next to the experts here. What are some other examples, or why is it important to have this more holistic approach to actually see results with these topics?
I'll go ahead, continue to have the mic still. In trying to identify the root causes of a lot of the issue that community members here in Northern Arizona face, you learn that it's not always, some of the things that we might think of. For us in Northern Arizona, with our populations from the tribal nations, often folks are stuck here and they don't have transportation back, whether they're here looking for work, or they get caught up in our judicial systems. And so it's sometimes the simple things like transportation and economic opportunity that I've come to realize are at the roots of some of these things, but that might be a little off topic from what we're trying to focus on today with mental health. But I think it's all tied in when we talk about homelessness and this bigger, broader umbrella right now. I'll pass it on to the rest of the group.
Well, what I want to emphasize about that comment you just made is that sometimes the solution is simple, and sometimes it's a solution that everyone can be a part of, a bus ticket. And so I thought that was a very important on-topic comment. John?
Yeah, I think it is very important. Just a quick example. I was in Safeway the other day. They've always got people right outside that parking lot who are homeless. And there was a young woman there with a couple of small children, with a sign, homeless, need food. And I rolled down my window and I said, you can go to the family food shelter here in Flagstaff, and there's no questions asked. You can receive a supply of food. And she said, I have no way of getting them. This is to Adam's point. She says, I have no way to get it. And I said, well, hop in, bring the kids, I'll take you down there and we'll get you some food. And I don't do that very often, but I can bring in a lot because we have a significant homeless population here. But it's just another example of how sometimes it's these little things that can make a gigantic difference. And I've often wondered, well, what if, and I'm not putting this on you, Adam, because this is a community responsibility. It's not just one that falls on city council, but what if there were a publicly funded van that went around the city and for people who are homeless and who just needed shelter, give them a ride down to the homeless shelter, the FFS. For those people who just needed food, take them down to the family food center. And there are an awful lot of human needs that could be met with something that simple. So I'm just wanting to underscore the importance of, I think, the point that Adam made.
Couple things, and I'll go back to Adam, and then we'll see if Janet or Shawn want to add in. One is, first of all, thanks for doing that and showing by example this idea that we can all take an action that will have an impact. And at our community town halls, which are a little bit different from this kind of panel presentation, one of the questions we ask at the very end of every community or future leader town hall is, what's the one action you'll commit to take? It's that recognition or reminder that all of us as individuals can take one step. or it might be an Uber, token or whatever. I guess it wouldn't be a token anymore. Right.
Yeah, really quick follow-up to John's point, I'm also the chair of Mountain Mind, the local bus service, and we recently set out a pilot program along Huntington corridor of a flexible service where they can pick up folks and drop them off anywhere in this range. And so folks can get a ride from the shelter to the food center, where they can get a hot meal in Sunnyside, and then back to the shelter. Because transportation is such an issue. And we're also distributing free bus passes to the new care response team, which is a alternate response that we released about a month ago in the city. And so they'll be giving away free bus tickets to those that they engage with. But yes, it's the basics, right?
Well, and I'm gonna just pipe in on another example, and this is how someone like me, as a private citizen, could engage. Is there's an organization, there's a program here in Flagstaff called Better Bucks, which people who are panhandling, like the lady you said, she needed some help, she had her sign, and we see a lot of that in Flagstaff. But there was a nonprofit, one driving force, who collaborated with our police department and started the program called Better Bucks, where instead of handing money, I can go buy Better Bucks that can be exchanged for money in stores for food. They all come with a bus pass. So programs like that are, they're there in the communities. You have to educate yourself to learn about how you as a private citizen can take that step too. But programs like that show it.
And I'll just add, I do think that as all these examples offer, we're really blessed to be at Flagstaff. The resources that are available and the willingness of people to kick in and do more is something that I've worked in a lot of different places in Arizona, Colorado, and back east. This is very unique, and I think that's something we should appreciate. Do you remember the one example of the Phoenix PD or the Flagstaff PD a few years ago that made me laugh? We actually were in our building over here on Yale behind Safeway on a weekend. It was middle of winter, freezing cold, driving snow, and our chief medical officer kept smelling smoke. And so eventually I just walked outside to walk around just to make sure there was nothing going on around her office. It was a homeless person who had built a little fire in a little space under her window in the office. And so I ended up talking with him, just about what was going on. And the people at Safeway apparently had already called the Flagstaff PD to come over to see what was going on. And so as we're talking, and I was talking with him about driving him over to the shelter, the Flagstaff PD pulled up. And what happened next was the Flagstaff PD officer and myself had a little bit of a arm wrestling match over who gets to drive this person to the homeless shelter. Because the police officer like, no, this is our job. Do not steal our work. There aren't many places in Arizona where you're going to have that happen. The PD is that focused on an individual's welfare, and I think we're really blessed. NAH is a great partner. We've worked on so many different issues over the years with NAH, going back to when we were NARBA in the old days, and more recently we worked with NARBA and TPC. During those when hotels were stood up for COVID, they did wrap services, and we support that. You don't see that kind of collaboration in places. And I do think that would be something that if there was a way to bottle it and export it to other places in the state and in the nation, you would not see some of the challenges. That's not to say we don't have challenges. We still do, but to see so many different organizations always being willing to come together and try and do the right thing is a truly unique blessing we have.
Well, and it can be an inspiration to show a model of how it works. And I should add, while we're here in Flagstaff in person, I know that virtually we have people watching from the Verde Valley, Sedona, Prescott area. And so there may be models or systems you've put in place that can help with, give them ideas of what to do in their community. Now, I know, and I knew this even when I asked him to speak, that Adam's going to have to leave a little bit early today. And so I want to pick on him first. I want to make sure we have lots of opportunity to share your wealth of knowledge. So my next question, but I'm actually going to have everyone else answer it first and Adam last, is what role should elected leaders play in addressing this topic? What role should they play? And it doesn't have to just be the city council member. Feel free to bring up all your elected leaders. We're just going to put Adam on the spot for all of them.
Well, you know, you want Adam to go first, you want somebody else?
I want you guys to go first. So if he has
Okay,
to
that's what I
respond,
thought.
you're going to say, wait, that's too much, or I can do that.
Well, there's certainly a role for committee leaders and public officials like Adam. Public officials can be great conveners of stakeholders to get problems addressed. There are some things they can't do on their own. I mean, Adam gave an example earlier of where he and I guess others on city council took it upon themselves to address a transportation issue. That was going to be at least a partial solution to this problem. They can provide funding to some degree for some of these things that are necessary. And they also have the power of persuasion. They can bring these people together who need to work together and try to get them, well, in many cases, they don't work as well as they do here in Flagstaff. Shawn made that point, but we can always do better. And there are going to be circumstances where it's absolutely going to require a collaborative approach to getting something done. And I think city council members can be very effective in making that happen.
You're saying that Adam needs to host a community town hall and provide the funding for it. I think that's what I heard. Who else wants to give Adam some ideas? Jen?
Well, one of the things is I read the report that really stuck out to me was the whole idea of things getting siloed and not working. So maybe not working across organizations, not working across the needs, you know, mental health versus substance abuse versus homelessness. But I work across a wide geographic region, and so that stuck out to me as maybe getting siloed across a geographic region, because the population we're talking about in some cases is very transient, and they might be in Flagstaff, they might be up in one of our tribal, you know, neighbors, they might be over in Holbrook. So it's transient in the there's connections, and I think that the elected officials through their counterparts can play a role in that too, with connections besides the ones that John talked about. It's more broadly on a geographic scale.
Yeah, I'm not going to disagree at all. In fact, I'd like to emphasize kind of what John and Janet both said. First of all, I'm cheating because I'm a former city and county manager as well, so I come from a government background, and really facilitation is the appropriate role for elected officials in this realm, because, you know, as Janet said, and the report I think does a really nice job talking about is every one of these areas is siloed, and even within each of these three main areas we're talking about, there are sub silos that exist, and you know, circumstances change constantly, and so an area that might have been a gap a year ago might now be filled, but an area that used to be filled might, because of something happening in nonprofit league in the community, a policy change at the federal level, suddenly becomes a gap. And one of the things that government does well is monitor that big picture and bring together those resources from time to time to adjust and change and constantly address that ever-changing landscape. And you know, it's not easy, because you're, in many instances, you have to be prescient and trying to guess what's going to happen next, to figure out what happened, or things happen so quickly you can't move fast enough to address those resource changes. But government in general plays that facilitation role and really helps break down those silos, or at least convene the silo holders to be able to do a good job to address that. And again, we've got really fortunate many places in northern Arizona, probably because we're all on the I-40 pipeline. People move so readily from place to place, have had to find ways to address kind of those ongoing needs as those circumstances change.
Okay, Adam, it's your turn.
All right. I agree with what everyone said. When folks ask me what the job of a council member is, I talk to folks who are running for office. I tell them our job once you're elected is to bring people together and work through the objections and the hurdles, right? Shawn, from your experience and others in leadership, that's what we do as electeds. We act as a glue, and we help us problem solve and reach that finish line, that goal. And I think that collaboration is key, and there are a lot of silos given the different funding sources and just the work we do, the nature of the work we do. But again, as folks are saying here in Northern Arizona, we have the Continuum of Care, the COC, who was put on by Heather Marcy and Northland Family Health Center. They do a great job of bringing together all the different providers and services and give each other updates. And we really have that synergy in Northern Arizona. So it's really a team effort. And electeds have a huge role in this, not just to do that, but to see something through, elevate an issue to the level of the city's business, to allocate funding to it. At the budget retreat this past week, I helped with council support to ensure that we fund a position to add to our care team. And this kind of goes back to our last question, Shawn, where you were talking about PD and how our community really cares. If we're not showing up with the right resources, it doesn't matter how many times we drive them across town or set them up with a temporary Band-Aid solution. We're not hitting the roots, right? We're just spinning our wheels. And so, we funded last week at our council retreat for the budget, a third position for our alternate response, which is a peer specialist. And that peer specialist is not only going to go out on calls and help engage the population we're trying to support, but they're going to also act as a case manager and follow up with the individual. So, and the key thing is that individual doesn't just look like me, another white person. They need to be someone that can connect with the individuals we're looking to help. Someone that has lived experience, who can speak the language and is part of the culture of which we're engaging. And of course, we're dealing with different people, so it's hard to say, but in Northern Arizona, there are a lot of Native Americans we're engaging with. And if we're not speaking their language and helping identify with their culture, I don't know if we're ever going to reach that promised land that we're hoping to get to. I myself am Israeli, and if it was Israelis out on the streets who were struggling, and I knew Americans were trying to help them out, that'd be a joke in my mind. That would not work. You need Israelis to help Israelis, just like you might need Navajos to help Navajos, and et cetera. So, I think that cultural sensitivity, not just through training, but through lived experience of your own culture in terms of how we set up the personnel that's engaging, is critical. And again, I'm not the expert in the room, but I do see the value in that. I believe that that's a very critical piece that we are missing the mark. Boom. Put that back on all you all. And I'll just say I have to leave at 3 because the council is going to be discussing the seat that our former Vice Mayor Becky Daggett, who's with us today, has left. She's running for mayor, and it's great to see you, Becky.
Well, a number of things that you all agreed on was this whole housing is healthcare and wraparound services. So here's a question from someone in the room. Given the high cost of housing in Flagstaff and the likelihood that many in our community could find themselves homeless, what are some solutions? Otherwise, this will add more people to the homeless population.
Well, this is a national problem. It's not just an Arizona problem or a Flagstaff problem. The lack of affordable housing is a gigantic part of this problem. And because even if you get people emergency shelter, you get them transitional housing, you get them other forms of housing that exist out there. If they don't have the ability to find affordable permanent housing at the end of the line, then you're dealing with a low ceiling here that just makes it impossible to really get at this problem the way we should get at it. So I know this will sound simplistic, but the solution is to create more low-cost, affordable housing. And as Adam mentioned, that's part of what Housing Solutions in Northern Arizona is doing right now. It's on the new medical campus that's going to be built, in the southern part of the city. Part of the discussion with the city of Flagstaff is there a role for some affordable housing on that campus? That's also part of the discussion about what's going to happen. I don't want to get too far in the weeds on this, but with the existing campus and how that's going to be redeveloped. affordable, low-cost housing is part of that discussion also with the city of Flagstaff. So I mean, it's very much on the city's radar, it's very much on our radar. But unless we address that issue head on, we're not gonna really get where we need to be.
As a panelist, are we allowed to phone a friend?
Yes, you can phone a friend.
Eric. Eric's our representative on Home Matters. And Eric, I know we're not talking just about Flagstaff, statewide. Home Matters is a big collaboration of all of the access health plans to provide funding for housing. Eric, you want to say a little bit about Home Matters?
Sure. So Home Matters is made up of the 7 access managed care organizations and the NARBA Institute. And each one of us has a representative on this board, so there's 8 of us. We are committed to raising $100 million in affordable housing funds divided between outright grants and low interest financing. Each of the managed care organizations, including Blue Cross Blue Shield Arizona and Medicaid, makes a significant contribution of its community reinvestment dollars each year to this program. And we have 4 grant cycles a year. We're actually in one right now where we are meeting to decide who's going to be funded. But we directly fund developers who not only are committed to affordable housing, but who are also committed to social determinants of health. So we're not just looking for, is this development going to be affordable, but we're also looking at, is it close to grocery stores? Is it close to schools? Is it close to public transportation? And they're scored primarily on the basis, they have to meet a certain financial requirement, but the real scoring differentiator is how much do you support social determinants of health, which is a critical issue on the Home Matters Board, as well as to each of the managed care organizations. It was mentioned that housing is healthcare, but we've demonstrated that when we look at a person a member that we serve 1 year before housing and look at their healthcare costs and then compare those same costs to 1 year after housing, there's almost a 17%, this is conservative, 17% reduction in healthcare claims costs. That's a significant number when you consider that it's not just a one-time reduction, it's an ongoing. Every year, there's going to be more and more savings. So, you know, I was talking to John Rivers before the program started. One of the things that you're starting to see more and more in healthcare is a movement away from the pure fee-for-services, treatment-based sick care system to a truly healthcare system that is value-based. In other words, what are the outcomes? Are we making you better? Are the quality of your life improving? And that's really becoming the measure of how people like Blue Cross Blue Shield look at ourselves. We're really repositioning as healthcare solutions providers, not simply health insurance providers.
The short answer, I mean, really is we need more housing. Let's just be honest. I mean, we need more housing for folks. And, you know, for years, we as a healthcare organization really did focus very heavily on individual housing for people who are on Medicaid. But as Eric is talking about, this really blows that wide open. We're talking about trying to provide seed funding for low income people who are above means for Medicaid, who can actually obtain housing through these kinds of programs. So we just need more housing.
So a couple things. First of all, phoning a friend. That was a great idea, especially when your friend is Eric Marcus.
Well,
And
it is nice to know
With a
that
safe phone.
it's still nice to know I'm on the Christmas card list. So
Yeah.
I appreciate
So a
that.
little special shout out to Eric, since he was the phone a friend. He was the speaker at our annual meeting who inspired this topic. So if you didn't know that. And a few other things. Our topic that we discussed for the last couple of years because of the pandemic was creating vibrant communities. The report and the outcomes of those community town halls, you can get them on our website. We have some here. it goes to everything that Eric and Shawn are talking about, which it sounds like you're saying not only housing is healthcare, but housing is reducing costs and economic efficiency for the entire community. I want to bring up, and I'll get to the other comments relating to this. One of the comments in the chat that I think is important as part of this conversation. And this is from someone who I know who's listening there from the Verde Valley. Leaders need to recognize the local and rural nature of the need and not try to foist solutions onto urban centers and systems. For example, allowing temporary lodging and RVs on single residential sites if assisting with transitional housing. So when we're talking about, and I'm seeing some head nods here, when we're talking about that affordable housing, to consider that. One other item I want to throw into the mix before you respond is this discussion that John brought up and others about building affordable housing. Well, what about the NIMBYism factor? Not in my backyard, I don't want to, so can we address that and how do we address that? Who wants to go next? Janet.
So I'm not sure I'm going to go to NIMBYism yet because there was so much in the previous conversation. You know, the idea of how do we address affordable housing? We've got to be creative. We've got to be collaborative. No one entity or organization is going to be able to do it on their own. We have to support creative ideas. Habitat for Humanity here in Flagstaff has a really creative new way that they're approaching affordable housing with some of our employers in town that hopefully they can spill to others. But, and I loved what Eric had to say, and I really want to dig into home matters with you at some point. But as you talked about it, some of the communities I work in, they have one grocery store. Some of them don't have any grocery stores. So they don't have transportation to put affordable housing close to. So how do we make sure that it isn't just in the urban areas or bigger communities like Flagstaff that we come up with these solutions? Because there are people in Winslow, Holbrook, Joseph City, Show Low that need affordable housing too and want to stay in their communities. So that was a thought I had through the previous conversation. And I'll let somebody else take on NIMBYism.
Adam's ready with all the solutions.
Yeah, I wish. So I do have to leave to this comment, but I really appreciate this discussion and all those in the room. I'd love to hear more from other folks here too, the experts here. But yeah, I also want to mention the front door program that is happening in the city of Flagstaff with a lot of different partners leading that, especially Catholic Charities and the shelter services, the transitional housing that's being built, with the motels and such. Habitat for Humanity starter homes, I think, is a big solution here. They're building small homes, land trust homes, where it's $1,000 mortgage and it's $1,000 a month and then $1,000 down to basically buy the home. And then over the 10, 20 years that you live there, you're building equity. And so when you leave, your rent is basically given back to you as a check. So you leave with 10,000, 20,000. So, you know, we need workforce housing and housing like this all over the community. I'm trying to get NAH to do this. And I'm glad that John's here to echo that that's something that's being heard by leadership, which I know that they're taking seriously. Not just housing that's going to be sparked around NAH's new campus, but within the development in a solid infill project. I believe a LIHTC project is being considered currently. But the issue with LIHTC is it's only 30 years. That's here and gone in no time. And so we really need permanent housing. But obviously with the Arizona state ledge and the laws that exist in the state, it's hard as a city to figure out how to work around that in terms of inclusionary zoning types of approaches that other states are able to do in communities. But the city council has been a very strong negotiator with developers, with rezones especially, trying to negotiate for lower AMI level units. And we've been fairly successful at that, but it's a small amount relative to the need. And you know, someone brought up the idea of different like opportunities for camping or RVs. And Eugene has a bunch of different pilots that they're exploring currently. Their issue is a lot different than ours. It's a lot more visible. And I went out there and visited it myself. And I brought this up as a item to discuss with the council at the time, this was a few months ago. And the council didn't necessarily like the idea at that moment, but they were open to the idea coming back to us. But we need creative solutions and we need strong leadership. And you better believe that NIMBYism is strong and is really weighing on the city council, regardless of where you're living. So we need your voices at City Hall to help empower council members to do what's right, to overcome the NIMBYism, to approach these creative solutions in manners that make sense. I think my last point I wanted to make before I have to dip out, there are a couple points. So last week, again, we had our budget retreat and the city of Flagstaff is committing $1.6 million to programs like down payment assistance and other housing efforts. And that's the biggest amount of money we've committed as a city through our own budget process, not ARPA funding. ARPA, we also did a really good job with that. I'm proud of the work we did. But I've never seen the city commit. We had a fight for 400,000 a few years ago. And now we're talking about 1.6. The city of Flagstaff has declared a housing emergency. And so I'm proud that we're putting our money where our mouth's at. Because talk is cheap and often we talk a lot. Lastly, as I run out of time with you all today, I just want to talk about treatment and that, I might be jumping ahead a little bit, but I saw in the report treatment is covered. And that's what I've learned is one of the bigger missing links in Northern Arizona is that if someone needs substance abuse treatment, they have to go to Prescott to receive a 70-day treatment service. And that's not realistic for a lot of our community members. So there is a company, American Rehab Campuses out of Tucson, who has bought land near the hospital, the mall, and they're working through the city's process of annexing that land and building a rehab campus with programming that they're customizing to the population. And I got the chance to tour their campus in Tucson a few weeks ago, and I am so impressed with what they're doing. I think they're really doing an amazing job, and I'm curious what other people think about that. But that's coming to Flagstaff soon, and they're going to offer a detox center and also this longer-term treatment opportunity. And so that fills a lot of gaps that I have identified for the community. And so we'll be able to take those to these centers. Responding to them is one thing in a crisis moment with the right team, not a police or a fire or even NAH, but with a right team of folks. And then what do we do with them after that? That's where the work begins, right? So I'm glad to see the pieces coming together for us. And with that, it's really been a pleasure being with you all. Thanks for having me.
Let's give Adam a round of applause. Thank you. Oh, go ahead.
Just grab the NIMBYism one just real quickly. That's
Please,
and it is-
absolutely.
Back when I was a city manager, I'll say one of the common phrases we used to always talk about is NIMBY is the only 5-letter, 4-letter word of the book. Because it is such a massive challenge. And it is, I will say to the question of what can you do about it, there's no single answer, of course, but a few things that over the years we've seen work. I think Flagstaff is doing a great job of this. We're definitely seeing a lot of work being done in other communities, both in the rural east, Shimoni area. Icon has done a great job. Some work on this. But a lot of it comes down to scatter site and incorporating lower income housing and other programs that are in rehab development. So as you're redeveloping an area, having the local government require that be a part of the redevelopment so that it becomes an integrated part of the community as opposed to a separate development just for that. That's been a very successful strategy. The second thing is scatter site housing in general, if necessary. While it's not always great from a rehabilitation standpoint, having people in scattered locations that are government funded or supplemented is a good solution. And then last but not least, the one thing I think we collectively don't do a great job of, but we should do more of is celebrating our successes. The way you're going to overcome NIMBYism as an attitude is for people to realize that it's not true. That all of the dire predictions of theft and murders don't happen in virtually all of those cases. So celebrate those successes when you develop it. I remember in Eager, there was a redevelopment that the Colorado Behavioral Health did of a small strip housing unit, and there's a lot of NIMBYism back then, and they were able to overcome it with a lot of positives after they reopened it. But yeah, those small communities, Janet, you're absolutely right. Conjo Community Center is a great example of one. That's really done some great things in an extremely rural environment, but the urban solutions don't work.
So a couple things on that. And first of all, because I know we've got some Yavapai folks watching and they're submitting questions. You gave a shout out to Yavapai. So shout out to all of you. And one thing I learned from some folks in Yavapai at another program, they've got a group that started this Yes in My Backyard, YIMBY. And so, you know, kind of the communications, the marketing, and that's a catchy, obviously, I still remember it, Yes in My Backyard. And one of the comments, this might be from someone in Yavapai, I'm not sure, is this idea that there's tiny home community models in other cities that are very successful, and that maybe that's a way that also provides dignity of treating or housing those who have different issues. And there's been talk about that kind of a model. And then there's been some other models brought up, both by some of you, some examples. And in our previous background report launches, there was some discussion, and some of this is separate as well with the Department of Housing, from talking to them, with having school sites build homes for, because it's easier to zone, build more affordable housing for teachers and others on those school sites. So taking all of those examples and some of the ones that you brought up and that Adam referenced as well, are there some best practices in your experience that you think every community, whether rural, urban, tribal, that you've seen work really well, that we should tout and showcase?
Best practices in what context? Are we talking about NIMBY still? We're talking about affordable housing or?
All of the above.
all of that?
But you can just pick one. if you want.
Well, you know, even though you characterize me as an expert, in my work day, of course, I didn't work in this area at all. Most of what I know, I mean, I was in healthcare for, 40 years, as you know, but most of what I know about this issue, I've learned as a volunteer board member at the Central Arizona Shelter Services in Phoenix. And so it's been my volunteer activities there that have taught me most of what I know about this particular issue. And I think the campus there itself is, this may relate to some other questions you want to talk about later, I leave that up to you, but I think the model that exists there in terms of best practices is the right model. The whole idea behind Human Services Campus is bring together under one roof all the resources necessary to deal with the problems facing homeless people, so that we're not get away from this siloed environment that has typified the way it's been approached in the past. So if you're a homeless person on that campus, you need an emergency shelter, it's provided there. If you've been a victim of domestic violence and you don't have any clothes except the ones that are on your back when you fled your partner, well, St. Joseph the Worker has a program there where they provide free clothing to people who need it. You don't have any teeth because your husband knocked them all out. We've seen this. Well, we have a dental clinic there that'll provide restorative dental care for people who need that. We have social workers, caseworkers, and others who will then help move those people through job retraining programs and help them with, to Adam's point about the basics, the simple thing. How do you put together a resume? How do you interview? I mean, if you're homeless and you've been in that situation like the one I just described, you really need help all across the board. And so the model there, although I don't know that I would describe it as a utopian model for how you get at this problem, I think it's a really good model. And I think I'd like to see more communities approach it in a similar way.
I was gonna say, I think on the same vein of it's breaking down barriers, making it easy to access services. And I think, again, not being an expert and looking at this from a, community member funder perspective, Adam mentioned the front door project here in Flagstaff, the way they work together to make sure that wherever someone enters and needs services, it's coordinated and it's not going from agency to agency, providing the same information, trying to get into a housing situation. So I think that is, in my mind, that's best practice that I don't think is unique. I think there are many of those models, but I think that's very much best practice, breaking down barriers, making it easy to access services. And whether that's bringing everyone together, like John talked about, or having a program like Front Door, where if they end up at Salvation Army or if someone tries to access services at Flagstaff Shelter, they all get streamlined and those agencies are working together.
I don't disagree. I think, there's every community is from its one thing we've learned over the years. I think there's no one size fits all solution for it. But if there's one best practice that probably leads and crosses most of the boundaries, it is having that central, having a local government coordinated central resource center like the homeless campus. Yes, all fun. I was with Maricopa County. You guys are great. That kind of a program, and it does translate to small communities as well. I mentioned the Concho Community Action Center, little dinky Concho in eastern Arizona that very few people have ever heard of, much less been to. But it has a really well organized little community center that does a lot of the same things that the homeless campus does on a much more on a much more micro level. It's a great job. So I do think if there's one thing that would be great to have in every community, it'd be some version of that program.
So, and this is great, and you all have consensus on that, so a model for every size of community and whatever it may
Would
look
agree
like.
too.
Yeah, and Adam would agree too. We'll just agree for Adam on this. We'll let him know later what he's decided. And so it's interesting with this model, we're talking about when people are already in crisis or experiencing challenges. So here's another question from someone here in the room. It takes a different slant at that. What role does or should prevention play in mental health, homelessness, and substance use disorders? How do we get systems and funding to shift to the front end rather than the back end?
That's a great question. I think the entire emphasis should be on prevention myself. We have a tendency to approach problem solving in an episodic way, not a systemic way. We're always dealing with problems on the back end and how do we fix this and how do we fix that? How do we coordinate this and that? As opposed to how do we prevent this thing from happening in the first place? And that's actually been woven through a lot of the conversation that we've had, I think, already, which is dealing with this thing in a holistic way. If you attack problems of substance abuse, you're going to be dealing at the same time with attacking problems of mental health and problems of homelessness. I'll give you one example. One thing I wish we had here in Flagstaff is a detox facility. A world-class, first-class detox facility. Maybe there's one here that I don't know of, but I've raised this issue within NAH because we've had problems over the last couple of years, especially with COVID, where you have a person on the street who's intoxicated. Maybe they have some mental health issues as well. They're causing a public disturbance. They're picked up by Flagstaff PD. What does Flagstaff PD do with it? Well, they might take them to jail if they think they're a public health, if they think they're a public hazard, or because that's their job is to protect the community. It's not to treat the problem that the person has. Or they might drop them in the emergency room at FMC or BVMC, where we're not a detox facility. We're not, we're an acute care facility. We're not equipped to deal with that problem. And so something that may sound simple like a detox facility is taking a person to a place where they can get the help they need, as opposed to dumping them in jail or dumping them at the emergency room, which are the least helpful places to put these people. So I think prevention is really the key to the whole game, to be honest.
I was just gonna say, so, prior to working for APS, I worked for the NIH healthcare system for 16, 17 years. And the question of a detox center, I worked on a lot back then in my role in the community relations department. And I don't know that there is a great answer. We tried a couple of different things. But again, I almost think to the prevention piece, what spoke to me in the report was the conversation about how long it can take working with someone before, who might need services before they're ready to accept those services. And I think that even goes to before the detox center, because part of when we did have a detox center for a short time in Flagstaff, we couldn't compel anyone to go there. It was voluntary. And if we got them there, if they weren't ready to accept the services, the fact we transported them there didn't do anything. And it was a very small number of people, that habitually came back over and over, sometimes 2 or 3 times in the same day to the emergency room. So how do we work with them even before that to try to get them ready to accept services and connect with them in a way that they can trust who they're working with and they're ready to accept the services? And that's a tough nut to crack.
Got a lot of tough nuts to crack, but I know you guys are the one to crack them. And we've got a few questions related to what you brought up with prevention. And one of them is, how can we get enough mental health providers in our town to serve those in need? That's one very specific question. And then the other one related is that substance and mental health rehab, let's assume the accessibility is great. But while an individual's in treatment, there's other responsibilities that don't go away. Childcare, rent. How do we, if prevention is where we think that there needs to be the focus, how do we turn to that? What is the role, I'll put it a different way. What is the role of business leaders, foundations, healthcare? Let's see, what do I call you? A business? What is your role in changing or looking at systems to focus on prevention, keeping these kind of questions in mind?
I'll start off, but I'm actually going to go back and intentionally blow up the last question a little bit.
All right.
Yeah, one of the struggles I always have is what exactly is prevention versus, the rest of the continuum of care, because it's just a big cycle. If you are addressing the needs of a person in the hope of avoiding a crisis or a negative medical outcome, we talk about that as prevention. But in reality, the same solutions you're going to have after the episode is over are the same things you're going to do for prevention. So it's just one big cycle. Supported housing, having supported employment, which doesn't get nearly enough press. Having those wraparound services for individuals in general are the biggest supports to eventually help avoid and therefore prevent crisis care. And so rather than seeing them as two different things, I think it's important that folks begin to think of this as a continuum, a big circle. And if we can address those core needs to help people, they'll in general have fewer crises overall. So I think it does take a little bit of a shifting of the mindset away from this dichotomization between crisis and prevention to see it as a whole life cycle all the way around. Because the solutions are all largely the same when it comes down to it. And you really do need to be able to address those unique needs of each community. Back to just to touch base on some of the things we talked about in terms of detox centers. I mean, it's a perfect example of one of the things that I was mentioning before in terms of the constantly changing public policy needs of each community. I mean, one of the things that I don't ever really connect the dots on is, two elements here. One, if you have a person who is in crisis and is a danger to themselves or others, or gravely disabled, or is progressively and acutely disabled, which means that they are basically at a point where they can't care for themselves because of a mental health disease, they can be forced through the court-ordered evaluation process to receive care against their will, There's no such thing in the Arizona policy if they're killing themselves. That's a public policy gap. That's a legislative gap. The work center that we had here for a while over at the guidance center that was funded failed, in part because you couldn't keep people there, even if they were killing themselves with alcohol. But also because the state law changed and it became suddenly, from a licensure standpoint, so expensive to run one. The only place where you could actually afford to run them was Phoenix and Tucson. A public policy. And that's kind of, wish I had one here for this. That's the public policy leadership where we need local governments to step in and say, we really want to see these as particular needs that will address some of the prevention and crisis and post-crisis cycle to try and get people, not just to keep going back to a local area rehab center, but also to break that chain going forward. And alcoholism is a bigger component of homelessness. We often talk about mental illnesses, that it's the only cause of homelessness. That's by no means true. Alcohol is at least as big a problem as mental illness. So there are a lot of things from a public policy standpoint that I think are still, on the list of things to be done.
Let me follow up on that, because I think that's a really good point. And I'll put it this way, and you've kind of answered this maybe, but you could add, if there was one law change or public policy change, whether it's state law, region, or local, that you think would make a difference that could happen, what is it? What do we need those lawmakers to know that this would make a difference in the system?
That's like asking me to pick my favorite kid.
Okay, if there were, how many kids?
Your
There
favorite
were
kid.
3. Let's get 3. Now, or how about an easy one that they can do now?
And I don't know that there are any easy ones. All of these come with political challenges. So I don't know that if it was easy, frankly, it would have been done. We're at the point of, there's no fruit that's low. It's all hard stuff. That said, it's worth trying. But I do think some of the one of the things we talked about, I think Eric and the team from NARBA actually a few years ago facilitated a discussion about this. I do think public policy changes around making licensure easier for rural alcohol rehabilitation facilities would make sense. We're actually fortunate here in Flagstaff, in Prescott Valley, and Kingman that we have, and in Shimoni as well. We have these crisis chairs, crisis stabilization units for mental health. We need something like that for alcohol rehab. But the public policy just doesn't support it the same way it does for mental health. So I do think that that's an area where it would make sense. I think it'd be politically really tough, but I do think, an extension of the quarter evaluation system to include, organic physical health conditions like dementia, as well as things like chronic alcoholism, potentially would be areas that should be explored from a legislative standpoint. And potentially the opportunity to look at state supported zoning considerations for affordable housing in large scale developments would make great sense. I have 3 kids, those are my 3 answers.
That's good.
I have a little different perspective on this, and I'm not disagreeing with what Shawn has said, but this ties in with the whole prevention issue. We have women in this country who are pregnant who are not getting adequate prenatal care. We're spending $3,000 a day to keep premature babies alive in our neonatal intensive care units. I think that every woman in this country who gets pregnant who wants to have a child should be guaranteed adequate prenatal care during her pregnancy. She should be guaranteed that she's going to be able to have that baby in a safe healthcare facility where she and her baby are going to be properly cared for. So instead of spending all of our money keeping these preemies alive in the natal intensive care units, the PICUs and the NICUs and all the other stuff that we do that costs a ton of money, why can't we find a way to make sure that women who want to have that child are guaranteed that they're going to be able to have that child in a safe and effective way. I mean, to me, that's part of what we've been talking about today. It's part of that's prevention, part of that's cost effectiveness. Part of that is just thinking differently about how we do things in healthcare.
I had a fourth kid, I think that.
Okay. Janet, do you have any kids that you want to advise?
Oh, boy. I've got lots of kids, but I don't know that I have a lot to add. I do think, I mean, Shawn and John have outlined some really big ones, but maybe at the local level, you know, things like the camping or the living in the RV that could be an accessory dwelling. We've done accessory dwelling units here in Flagstaff and made that okay. So programs like that, I think, are some, you know, local policy level changes that can.
Let me ask another question, because a lot of these, you know, there's a funding attachment, and that's where things get, can get challenging. If you had all the money in the world, what is the single thing that would have the greatest impact? And okay, you can pick 3 if you want. But if you had all the money in the world, what would you spend it on to address the intersection of these 3 issues?
Well, globally, you would put that money on prevention, I think. Cut it off at the pass, as we used to say when we watched Western movies as a little, as a small child. I would spend as much as I could on preventing these gigantic problems in the first place. And that involves a lot. And there's no one silver bullet I can give you, but then I can stay here that would do all of that. It just means tackling this problem at every level. Alcoholism, substance abuse, homelessness. That question shifts the discussion from what about this and what about that, and how do you solve the whole problem, which is really what you would try to do if you had all the resources in the world. Of course, we don't have all the resources in the world, and that's a huge part of the problem. But I think, you would build low-cost affordable housing in every community in the country if you had unlimited financial resources. Anywhere you can get around the NIMBY issue, which we talked about earlier.
Well, there you go, yeah.
And that NIMBY issue is a big issue. When I was on board of CAS down in Maricopa County, we dealt with that every week. Oh yeah, we need homeless shelters for seniors. And I think that's dealt with in the report that, the needs of seniors are vastly different than the homeless needs of young families or young men or young women, single young women, whatever the group is. And we were successful in getting a senior shelter started in Maricopa County, but that was running out here and here and here and here, and finally finding a way to get it creatively located in a community that was more NIMBY than not NIMBY. So it's just, it's a little bit like how would you solve world hunger, behind that question. I don't mean that to be derisive of the question, but it's just, it's so global, you would have to attack it from every angle. But I would put most of the resources on the front end, not the back end.
What I find interesting about your answer, though, is you keep going back to prevention.
Mhm.
Even if you had all the money in the world, or if you had only a set of money, that prevention is where you would focus the efforts. And the one thing that hasn't come up as clearly yet in the answers, but your phone a friend brought up social determinants of health, is the social determinants of health and how that impacts adverse childhood experiences. We know impacts your health for the rest of your life. We know impacts so many other things, even how long you live. So that ends up showing how global and how much we shouldn't silo these issues. It gets right back to some of the points in the report. Janet, you have all the money in the world. Have you decided how you're going to spend it?
So there are a couple of things in the conversation today that I think I focus on, and you brought up social determinants of health. as they say, the model Eric lined out, I'd have one of those in every single community in Arizona. And the centralized system for intake and help for those who still needed help, have one of those centers in every single community. I think that's where I would start.
I actually agree both. From the standpoint, I think we talked about earlier, those centralized community resource centers. Yeah, and those aren't just crisis centers. Those are meant to be, and they do a great job in many instances of helping prevent services, and on the back end, helping reintegration as part of that cyclical approach. So I think every community in America should have one of those funded. All the money in the world definitely go there. I do think housing first is incredibly important. I mean, without stable housing available for people, you're never going to be able to solve any of the other issues. So the other place, if I'm picking my 3 kids again, that I would go to is community centers, housing, and then we talk a lot about it, but food insecurity is a huge issue, and having available food resources is something that I think as a third leg of the stool would be incredibly important to make sure that it's available in every community. And all of those really support that entire social determinant of health equity basket of issues that we very broadly talk about whenever we're talking about prevention, crisis services, or even, for example, in a jail and post incarceration environment, reintegration back. So it was really kind of the 3 legs of the stool.
So it's interesting you brought up reintegration back into the community, because when we took on criminal justice as a topic several years ago, we found that NIMBYism was again a big challenge with getting people reintegrated back into the community. And John, when you had all the money in the world to spend, NIMBYism was still a problem, right? And by the way, notice Yavapai County that he brought up the term NIMBY, I think twice now, so you're starting the trend. Is there a role for individuals or those interested in how we address NIMBYism? Is there some, should there be time or money invested in communication tools? Is there anything that's shown to be effective that you haven't already brought up by showcasing the good examples?
Maybe it's per se, but if the question is how can any individual who wants to impact this issue get involved? I volunteered. I mean, volunteerism is huge in this country. I mean, this country couldn't run without it. So in fact, when I retired, somebody had, and everybody wants to know, what are you going to do when you retire? And
Work harder than I did when I was
yeah.
working.
Now I want to know how do I ever find time to go to work? Because I'm volunteering my time at things that I care about, where I think my professional background and experience might help make a positive difference. And it just so happened that at the time, of course, at the time I got involved with the homeless issue in Maricopa County, our corporate counsel was on the board there, and the deputy director of access at the time, Joe Anderson, was a wonderful man, great businessman, but also a guy with a big heart. He was chairman of the board down there. And so I kind of wormed my way under the homeless shelter board in that way. So anyway, without getting into those weeds too much, I mean, if you want to make a difference, if you're willing to donate your time to a civic or charitable cause that you believe in, there's no limit to the number of things you can do, whether you're working or retired, or the opportunities there are limitless. So I would just put that right out there as the number one thing I think you should do. Volunteer your time, make a difference.
The Arizona Town Hall could not run without volunteers. Sitting next to one of them here, if you retire and you need something to do, I guarantee you, if you come to me and say, how can I help, everyone knows I will find something. But thank you for that, John. I want to broaden that question to what can individuals do? Maybe you're not retired. Maybe you're busy working 60 hours a week. And Janet.
I'm going to start, and I am also going to apologize, just like Adam, I have a prior engagement. I have to be open to work with a community that's facing a major employment change in their community. So I've got to head a couple hours. But to the question about what can you do, I work a lot. Communication to me is so important. And if I could get everyone to seek first to understand the other side, that's where I would, sprinkle my pixie dust or spend my money, because I think when you take the time to understand and learn and communicate about an issue, I think maybe we can make some progress in the NIMBYism. And it's, again, another tough nut to crack, but I think that's where I would start. I completely agree. Volunteerism is a great place to get engaged, but not everybody might have that luxury. We're talking about people who are running so fast just to maintain and keep moving forward. So, but they could try to understand, they could try to learn. And if we could instill that in people, and I can help instill that, that's what I would want to do.
Janet, that's one of my favorite quotes. I want to start with that, and then I want to bring in a comment as you're about to leave that would be great as sort of an employer community representative here from one of our folks watching on the webinar. The comment was, I think it would be wonderful for employers to allow their employees to donate 4 hours of paid leave every month to volunteer to work in programs in various geographical locations and that are networked through partnership programs. That could tap into talent, services, and resources, and for those people who need to work, and maybe APS already does something.
I can't agree more, and I am blessed to work for an employer who supports volunteerism all the time. I know not every small business, not every employer can, but if there is a way to work that in and to do that, I could agree more.
Back in the day when I was an employer, and one of the things I asked every employee to do when they submitted their own self-assessment was, as a part of their annual performance review, I wanted to know what they were doing by way of community service. I didn't put an hour limit on it or anything like that. I just said, I want to know, I didn't care whether it was an hour a month. I wanted to know what you're doing to help this community be a better place. And it's just amazing how that got everybody thinking about this issue. So, even if you're working full time, I was still working 12 hours a day when I volunteered to work the homeless shelter in Merton County. So even if you're doing that, I don't care whether it's an hour a month or pick whatever number you want. I think it is possible for everybody to contribute something.
And we're fortunate to Blue Cross not only has a program like that, but actually, in order to get your employee incentive, you actually have to do your community services there. So it's actually incorporated into the entire compensation incentive system. It's kind of fun. But even without that, I think it's such an important part of employment in general, as being a part of your community. It's, if you aren't engaged in those things, then you're part of the siloed ivory tower problem. And so having every employee in the organization in some way being engaged in community service is incredibly important part. And I get it, small employers can't do the same thing. So I don't couldn't necessarily be universal, but certainly would encourage it.
You kind of all brought up, and you specifically, incentives as a word. And Janet, I know whenever you need to leave, otherwise we'll keep bringing you into the conversation. We're happy for whatever contributions you can give us. Aren't there incentives, not just on an individual for employee levels, but can you think of maybe systems-wide changes where we can change incentives for whether it's communities, policymakers, things related to NIMBYism? And no, I did not prepare them for this question, and it's a heck of a question. All right, and so it's really kind of looking at systems change. How can we incentivize people to act in the ways that will solve these problems?
I'll just go back to my days as a city and county manager. I think that the things that I saw frequently is that the easiest way to incentivize positive community changes were to remove bureaucratic roadblocks to get it there. And so one of the things I incorporated into that conversation is if you want to get rid of some of the bigger obstacles, even NIMBYism, restructure the way that you do your governmental oversight review and planning processes to basically make it easier if you do certain things. That was very successful, I think, in some of the communities that looked in to overcome some of the other challenges. It's making things easy is actually one of the greatest incentives that people like.
That's a great quote. How do we make it easy to do the right thing?
And I think one of the great ways to incentivize people is by showing them that what it is that needs to be done is good for them, not just for somebody else, but it's good for them. And if we're improving community health and we're reducing the incidence of alcoholism and substance abuse and homelessness, that benefits every taxpayer, in the community. So even if you're some white collar multi-millionaire, whatever, you can say, what's that?
It's about the way Facebook.
Or Twitter.
There you go.
Or some other.
But people are incentivized to do things that they feel benefit them. And sometimes we're not doing as good a job as we should at letting people know, hey, this is good for you. I mean, yes, people have big hearts like to talk about doing things that benefit the community, are socially responsible, and that's all good. I'm not diminishing the importance of that at all, but at the end of the day, when you convince people this helps you, then that's an incentive that works every time.
So things like showing that this makes your neighborhood safer.
Yes.
This makes your neighborhood more economically viable. And so I think I'm kind of seeing this marketing campaign, perhaps, whether it's a paid marketing campaign or it's just going back to what can an individual do. It's talking and sharing information that having different levels of housing and true connection makes the community stronger. So, there are a lot of communities that feel like this is such a big problem. What do I do? How do I tackle it? I mean, the background report is what, not quite 200 pages, almost 148 pages. That's with the note pages though. But yeah, but it can be a very difficult topic to tackle. Are you aware of resources or maybe even steps that small communities can take who don't have maybe people with your knowledge of this intersection that they can access right now that they should know about?
Actually, there's a pretty good resource to start with, so.
Did you hear that, Morrison Institute? Great resource right there. Yes, and that's true.
I do think that's a good game plan in many ways. We can draw from that. There's other resources as well. For example, Northern Arizona University did a health equity study that was funded in part by us, principally by NARVA Institute, actually. And that's a great resource to use. International City County Managers Association has several resources that are available from a governmental perspective. So I think there are a lot of different resources that are available to different communities if they're interested. Actually, I think yours is probably the best starting point for it. A basic, where do I begin? But I think local governments are the hub. I can't emphasize enough how important local governments are, both city and county, in helping marshal resources. And once they've done that, then the nice thing is in most communities, the healthcare community, the social service community, the religious community, the educational resource community tends to really work well around that marshal. So, working, it's another thing, talking about volunteer, the greatest thing to do to volunteer, if you really, really are brave, is become an elected official. Oh, scary as hell. I mean, that's partly why I was always an appointed official, is because I never was brave enough to become an elected official. But being an elected official is a really, really important job.
And when we talk about resources, You know, there's financial capital and there's human capital. And there's actually a fair amount of financial capital out there. It starts with Congress appropriates a considerable amount of money, and especially over the last few years, to address this issue. Typically, that flows through state departments of housing. And from there, they have the resources to get that to county governments, local governments, city governments. And I don't think that you really have to look very far in most communities to find ways to access some of that, talking about the financial capital aspect of it. And I'm not saying that everybody's, you know, got money flowing out of their pockets to deal with this issue, but there are resources out there, and there are people who can help you find those resources.
You know, often there's a shortage of resources. There is one area I learned recently from Tom Simplot, the director of housing, where they have a lot of resources and they need people to access them. So I want to highlight that. I did send the information along to Adam so he could pass along, but it's for people who are having trouble paying their mortgage and other bills related to that. So you have to be a homeowner. And just know there's a lot of money sitting there to help people if you are a homeowner. Now that is and that's available right now for, sounds like an ad, for a limited time. But if there are people who need those resources or information, you can certainly contact the Department of Housing or us, and we'll get that information. What would you tell a community who has no money? What's the one thing you can do if you have no money, no financial resource? What would it be?
Find a volunteer grant writer.
Find a volunteer grant writer. Yeah, okay.
And grants they're huge amount of grants, even if you're a small community that doesn't have a lot. I mean, a number of those over the years. And there's tons of resources you can get. You do have to apply for it. You have to know what you're doing to do that. But that's the start. It's really getting somebody who can do a good job of bringing those resources in that are available and being careful about how you do that. I mean, your Tom Simplot's program that you're talking about is not an example of what I would just say. But in many instances, many of these grants have administrative costs that are so high that it's not worth applying for them in the first place. And we administer a grant that came to us through a program from federal government that we had literally several millions of dollars available, but we couldn't get anybody to apply because it was so burdensome to try and administer it that none of the providers wanted to take it on, even though it was a lot of money for really good opioid related costs during COVID. So you have to be careful. So good grant writers will also be able to screen out. That was the first thing I did when I took over a small struggling city government, was hire a good grant writer. Because she more than paid herself 10 times over the ability to bring in those resources to do cool things.
It makes sense to some people, but it makes sense to some people like Shawn's been facetious, but he's ready. And there are those resources out there. And there are people who are very good. They do it professionally. That is the way they make a living, is by finding ways to get resources that are out there and just waiting for somebody to apply for it.
Well, it makes me wonder, as someone who runs a nonprofit, knows how challenging it is to file for 100 grants. You might get 2 of them, and it takes all this time. It is exhausting, and you need someone who really knows what they're doing. Maybe, Northern Arizona should hire and pay for a grant writer for all of its communities.
Yeah.
Coming together where you have one person and that is their sole job for the entire, to look for those federal grants and other grants. Because that's a tough job.
It is.
That's
I mean, it's two
challenging.
toughest jobs. I think that small communities deal with the grant rating, and then having somebody to basically administer those. And I know NACOG has done some stuff. Right, Eric, shake your head, yes or no if I'm wrong. But NACOG's done some stuff around that in the past, but I do think that's an unfulfilled opportunity to really support communities. They have a good strategy to be able to, but it's certainly an area that collectively we can work together.
To that point, before we leave that point, I'm on the board of a small organization that helps returning warriors, veterans. I'm a veteran myself, so I have a soft spot in my heart for vets, especially those who are coming back from overseas deployments. We raise, I mean, we're a very small nonprofit. We raise about $400,000 a year that we give to basically social service departments at VA hospitals, who are the ones who come into contact with these veterans who have these great unmet needs that are not provided by VA. And we have a professional grant writer who probably raises about 60% of the money. And we have zero staff, zero paid staff. It's all run by veterans who are volunteering their time and effort to this cause. So just another way of underscoring the point that I think
I'd like to get your professional grant writers thing.
shows.
Are there any other questions in the room? We're getting close to the time. All right, well, should I turn it over back to Evelyn, our who failed at retirement? Another failure. Yes, and we're happy to have.
Bill retirees are what make the work go round.
So we're finding out, right, John? So, well, let's give them a hand. Tara, panelists, and Morrison. To start our closing, special thanks to NACOG for hosting the event and to the financial sponsor of the launch I mentioned a little earlier. It's Giza Law Firm, which includes a member of she volunteers, a member of the research committee who helped create the background report, Halle, and we're going to give her a couple of minutes to say a few words. And I think we've got her online. Alex, if you want to cue Halle or however way this works.
Thank you. Are you all able to hear me okay?
We can hear you, Halle.
Great. Well, I've been listening here in my office this afternoon. This is the third launch that I've been able to listen or to participate in, and it never gets old. The subject matter, the panelists' perspectives are always so important. And it's an ongoing reminder of the privilege that it is to be associated with Town Hall, which is one of my favorite activities, as Tara and everybody know, but also on this such an important topic. My firm is generally both a criminal law firm and also a law firm that does a lot of civil rights litigation and plaintiffs litigation, often for individuals who have mental illness, serious mental illness, and are deeply justice involved in our jails and prisons. But we also do plaintiffs work now increasingly for individuals in our system who are not getting maybe the care that we all want them to have, and who, in part because of that, fall into homelessness. Often they are individuals who have a co-occurring diagnosis, and they struggle. I came to this area of practice in part because of personal experiences in our family, and we were it didn't involve serious mental illness as it's currently described as a program in Arizona. But it certainly led me as a family member and a mother and spouse and so forth to realize the enormous need that exists and to make a personal commitment to become involved in this area, not only as an attorney, but in the community in supporting programs like Town Hall and in supporting our legislators who are so important in improving our legislative framework. I think that Town Hall is the perfect entity to tackle the three serious problems of mental illness, substance abuse, and homelessness, because Town Hall is so unique. It's an entity where we come for civil discourse and for civil involvement. But it is an entity where from the moment you walk in a town hall meeting, everybody there is listening, focusing, thinking about producing a consensus statement on all the issues that you talk about. What a wonderful opportunity for all of us to bring different opinions, different viewpoints, sit down and have a civil discussion, albeit a robust civil discussion at times, toward a focus of consensus. I'm going to go out on a limb, as I have twice before, and predict that the background report from this year's town hall will become known not only locally and around our wonderful state, but nationally as a treatise on the intersection of mental illness, substance abuse, and homelessness. It is a remarkable document. I had the privilege to sit on the research committee, and I am so pleased to see this document come out of an organization like Town Hall and the Mars Institute, both of which I respect and have such high regard for. I can't wait until November. I'm also so glad that there was a launch in Flagstaff. We live part-time in Coconino County in Sedona, and my daughter lives there full-time in Sedona, in Coconino County, not Yavapai County, Sedona. Of course, the city split. So it's a real privilege to be able to see this in our other home and county, and to be part of it and to sponsor it. So thank you all for coming. I loved the comments, especially the comments today about tiny houses and mobile homes, all of which, what great innovative ideas. I've seen the tiny homes in Austin. It's remarkable. And I hope that's just a tiny little indicator of the kind of wonderful, practical, realistic solutions for all of the state, both rural and urban, that we're going to see. So thank you all for being here. And Tara and Town Hall, thanks as always for another wonderful afternoon with the launches. I look forward to seeing everybody in November. Thank you.
Halle, of time and resources, Holly. So I'm sure we'll be seeing you as we have these town halls throughout the state. So to close, I've got 3 quick items for everyone here in person, as well as those of you online. So Arizona Town Hall and Arizona's like you will can make a difference, as our panel we're talking about, engaging in those local and statewide gatherings in these community town halls, aim to educate on the topic, as Shawn was mentioning, to catalyze those solutions. And I think we've all been inspired by what we've heard today. So the second thing is this event has been recorded, and the video will be posted to our YouTube channel, the Arizona Town Hall YouTube channel. So you can revisit that or share pieces of it with your colleagues and your acquaintances and your family and friends. And the last thing is, please, indeed, do contact us if you want to arrange a future or a community and future leader town hall. And we appreciate the generosity and partnership of the Halle Foundation, as I mentioned earlier, in supporting these throughout the state on this topic. And thank you again all for joining us. And we hope to see all of you at future events. So thank you very much.
It was so nice to meet you.